I'm Dr. Robert Moore, and we're here to talk today about how being overweight and obesity affects atherosclerotic cardiovascular disease, clogging of the arteries. I have people call me up because they have neuropathy, because they have chronic limb ischemia. Maybe they've lost an arm or of toe or maybe even their foot because of it, which is a really sad case. We had people call me up because they've had a stroke. They've had other issues, maybe coronary artery disease. They don't want to have a heart attack. They're on medication, and their doctor says, you got to lose the weight. However, nothing's explained to them as to why. Let's talk about why. Because when we're overweight, we get an accumulation of fat cells, and those fat cells get bigger, and they make something called an inflammatory cytokine. And what that is a variety of a bunch of nasty chemicals floating around our body from the top of our head to the bottom of our feet, destroying everything that's good and aggravating everything that's bad. So those cytokines, what they will do, we've talked about insulin resistance before, it will block insulin receptors at the site. And what that does, it blocks the way insulin can talk to a typical body cell. Now insulin's job in this case is to open up a gateway for glucose, sugar in your blood, to get in the cell, but that gets blocked. So we build up blood glucose. We also, as an effect, to try to kick it into gear, and we get insulin resistant, we start building up our insulin levels too, which is just as bad. Glucose will bind what's called a low density lipid, and that has an effect on plaquing of your arteries. These cytokines, they will also go to the liver, and they'll do a couple of things. They'll stimulate the liver to make some very low density lipids. Those are on the rise, which become high triglycerides. Those are on the rise. High triglycerides have an effect on clogging up the arteries, the atherosclerotic changes, a lot of pancreatitis also. Pancreatitis, more insulin, more aggravation of the arteries. But a big problem with the cytokines affecting the liver is it causes consumption of your high density lipids. Those are the good ones. So you actually get a decrease, a significant decrease in high density lipids. And that is a very big factor when it comes to atherosclerotic changes. I want to remind you also that high levels of insulin, because you have now insulin resistance from these cytokines, causes you to make more fat cells. You're unable to break down the fat cells. It causes mitochondrial degradation, so you have less energy to do the work you need to do. It actually allows your body to, it inhibits your body from healing from oxidative stress, the stress of life, chemical stresses, and it breaks down this epithelial lining. Now, a healthy blood vessel doesn't necessarily attract plaque. An unhealthy blood vessel anywhere in your body, because this stuff's all throughout your whole body, will attract plaque. And the problem with this is it can affect your brain. What does that do? It can cause a little infarct, aggravate the tissue. We call that a stroke. It can cause a cardiovascular accident and kill the tissue in your brain. So now you don't have temporary neurological damage. You have permanent neurological damage in your body, in your brain. It can affect your heart. It can cause coronary artery disease. Angina is one of those. And if that persists or it's really bad, that's called a heart attack. We don't want that. It can cause in your body, it can cause critical limb ischemia. It's called peripheral arterial disease. It breaks down the arteries, they get all clogged up, the arteries start to die. You get a lot of pain from this. As the pain persists, now we get chronic limb ischemia. And that's how people lose their toes and their hands and stuff like that. Being overweight has a very negative effect on all of this, through all of these mechanisms. So, what can we do to, lower the risk, prevent this? Well, we can lose the weight. And it just so happens that we have a safe program, an effective program. Women typically lose between 20 and 30 pounds in the first 60 days. Men, it's 20 to 40. We've seen people lose over 100 plus pounds. It's an affordable program, and we have lifestyle coaching to go along with this. So when you reach your goal, you're done with the program, but now we've taught you lifestyle coaching mechanisms and methods to help you maintain this program so you're successful from here on out. We keep the cytokines low, we keep the fat cells low, we stop insulin resistance, we stop beating up on your liver, creating all these aggravations. Your brain, your heart, your body does better, all because you lost the weight safely, effectively, affordably, and had lasting changes through lifestyle changes, which is what we do through coaching. So if you'd like to talk to me about this, we would love to talk with you on the phone and have set up a phone consultation for you or a loved one. Just simply call our office, 810-374-0304, and we'll see what we can do to slow this down, stop it, give your body a chance to heal, because I believe you can always heal. There's always hope. So God bless you. Have an awesome day.